Good afternoon, my name is Ross Jones, I'm a developer at Open Healthcare UK.
I'm Robin Winslow, I'm a developer.
I'm Colin Wren, I am a developer at St George's Healthcare NHS Trust.
I'm Vijay Joshi, I'm a doctor and a coder.
I'm Carl Williams, I'm also a developer.
For the past 2 days we've been working on NHS Bugs.net, which is our fault tracking system for the NHS. We focused initially on the patient experience and allowing patients to report issues that they find. So they can report issues where they can't find their way, complaints about the information that they have or haven't been given, and we have the ability for people to vote on issues that they think are relevant and should be fixed. And these details will then be sent to somebody who's responsible for fixing the bug or the fault, and they will come in and use the system. So, and we can then just leave a comment if we want to add something to the issue. So when based on the web, people are going to have to find the hospital, so they generally go to the hospital tab, they'll find the hospital that they have found the fault with, and then if there are any bugs, they're going to see them here and they get a chance to add a new bug, complete with a photo, at which point somebody will get an email asking them to come and read all about the bug and hopefully fix it. So as a user, we can go to My Bugs, we can see all the bugs that this user's reported, and we have the most recent activity at the top. And for some users coming from the NHS who are going to fix the bug, we have a checklist somewhere, just behind Colin. Okay, which then they can go through the checklist and they know exactly what they need to do to fix the faults. And it won't let us go back. So initially we just focused on the patient view. Obviously it's important that bugs and faults are reported from inside the NHS. I'm going to hand over to Vijay to talk about sort of the medic's viewpoint and also the mobile aspect.
Hi there. So what we've done is we tried to do everything simultaneously. We've had Ross here developing the back-end website as well as our other developer colleagues here. Myself and Colin here, we've been developing the actual mobile devices access to the exact same site. I've developed the Android version, which very simply NHS Bugs. Sorry, I don't have a tablet to show you it in a larger manner, but it retrieves your current location based off your GPS, works out which hospital you're at, allows you to take a photo of what your concerns are, and then afterwards, once you've done that, you approve what you're talking about, make a few comments, and you can upload it to the website. So this will be directly first-hand available. Now, Colin has started looking at developing exactly the same thing, but he's taking it from the other perspective, where you're looking at the actual iPhone, the iOS system, and maybe you'd like to talk through that for a moment?
Yeah. So we were able to pull together some apps based on the fact that all the data was there and we just really needed to pass it in an appropriate way. I'm probably not going to be able to show you the location services, but as you can kind of see here, we've got South Camden Centre for here, and the Royal National Orthopaedic, I can't even pronounce that. And as well as that, if the location fails, then we can do a manual search, which brings in, I think we've got 970 different health sites in this database so far, and then as you start typing, it narrows that down where you can also then access that as well. And it's awkward doing this. So I don't know if you go to the, what is it? Are you on the Agile Hubs as well? The first one, I did submit, there you go. So that one there says help, I'm lost. That was submitted on the iOS client as well. So they all feed in together, and I would be able to then also comment.
Okay, so what we've been doing is developing everything at once. We've been developing the website, we've been developing the iOS, we've been developing Android. So all of these different ways will allow you to access the system and also look at the bugs and track them and see where things are, how many people have thought they've been important, officials from the various NHS trusts will get an email informing them there's a problem, as well as how significant it is. They can talk about it, and hopefully mark the fact that they correct the bug. And people think whether or not they have.
Thank you very much. If we have the questions from the panel, remember we're going to change over, so if you come out.
The example you had of somebody being lost, are they going to be a skeleton before they're found? I mean, is it the whole point that they're lost in the hospital and therefore you're going to send somebody out to find them? Because, or is it just we have a big hospital that's the size of a small town, such as Addenbrooke's, and it's inevitable you're going to get lost and nothing we can do?
That's one of the silly examples, I think. I think the normal thing would be like the bathroom's dirty.
Okay, so the bathroom's dirty, fine. Thank you very much.
How will you create a good culture of the kinds of things people report and stop them being like vitriolic or abusive and make them actually helpful?
We haven't actually addressed that yet, but one of the things that we didn't necessarily want the people fixing the bugs or responsible for fixing the bugs to have to log on to the system. So they were going to get given a unique key that would allow them to go in and interact with the comments and the patients or the NHS staff. We're also going to give them the opportunity to report something as abusive, but not actually flag it immediately as such, and insist that other patients verify that it is abusive. But yeah, we see it as an important point.
Okay, thank you. We better move on.